Advice before you start the PTA program from the director of the PTA program. What's up guys, my name is Antonio and I work in physical therapy, and in this channel we talk about the ins and the outs when it comes to physical therapy. And in this video we're going to be talking about some advice before you start the program, or even if you are in the program, or even if you're about to finish the program, and about getting a job and all that stuff. So we're going to interview the director of the program. And currently right now, I'm on the campus of Baker, and they were cool enough to let me shoot this video to help you guys out. So we're gonna go right now, find the director of the program, and interview her. So I'm here with Erin Smith. She's the director of the PTA program here at Baker.
Yes.
She's been working in this field for a long time. She's been at Baker for 16 years. For 14 years, it's been a clinical coordinator.
Right.
And then for 2 years, she's been the director of the PTA program. So she's got a lot of experience. So tell us a little bit about yourself, Erin.
Okay, well, I graduated with my Master's of Physical Therapy degree 20 years ago at Oakland University. As soon as I graduated, I pretty much started working in inpatient rehab at Genesis Hospital. And my background has pretty much been inpatient rehab ever since. Okay. I actually still do treat patients. I used to be full-time treating patients, and then after about 5 years is when this position at Baker College became available.
So if you are interested in starting the PTA program, what tips would you give to someone who is looking, if this is the right field that they should go into? Talk about someone who's interested in this field.
Okay. The number one tip I would tell any person interested in the PTA program, or any career actually, is to find out what a day in the life of that career actually looks like. So go beyond researching it online and reading about the career, because that's only going to show you so much of that profession. To truly know what a PTA is going to do, you have to go observe them in their environment. So go observe when they're treating patients, observe what a day-to-day schedule would look like for a therapist. Another thing that I tell my students, or students who come to me thinking about going into PTA, I tell them there are many different areas of PT and physical therapy. So a lot of times people think it's outpatient orthopedics. You're working with people who have hurt their knee or hurt their shoulder, and they walk into the clinic and they walk out.
Yes.
That is a big piece of PT for sure. But there's a huge other area where you're in a hospital setting, or you're in an extended care facility, or some people consider that a nursing home. Or home care, for example. So I tell my students, make sure you see the full spectrum of what you could potentially be expected to do as a physical therapist assistant. Because in the program, you will have to show competency in all areas, not just what you think you might be interested in at the time.
That's a good tip. That's a good tip. So getting out there, getting in, job shadowing a PT or PTA, that's some great advice to get out there. That way you can see what's going to be expected of it.
And if you find that you do want to go into that field, you're going to need those hours to apply to the program anyway.
Exactly. You need your observation hours.
It's not going to be time wasted, let's say.
Yeah, awesome. Now, what would you say, speak to the group of people who are in the program currently, and they're maybe struggling through the program or whatnot, or they're looking for advice, so like maybe studying tips or different things. What would you give advice to those who are in the program?
Okay. I think a lot of times when people look at a PTA program, a majority, if not all PTA programs, are a 2-year Associates of Applied Science program. So we tend to get a group of a population of people who are maybe working full-time and looking at maybe changing careers. And I think sometimes it's missed about how much time it's actually going to take once you get into the program, as you know.
You get busy.
And so my number one piece of advice would be, when you get accepted into that program, you have to consider that your full-time job. If you can. I know people have to make a living and they have to pay for the tuition, but ultimately, once you're in the program, it is going to take a lot of your time. I know it's been said that for every 1 hour that you're in class, you should be prepared to spend 2 to 3 hours outside of class, studying, writing papers, papers, group
You always have something coming up.
presentations,
Yes.
being in the laboratory practicing, not just because there's so much of our curriculum that you can't just learn from the book, you have to actually do.
Yeah.
And so if you're not practicing those skills, it's going to be very hard to then be able to demonstrate the competency. So that would be a piece of advice for sure.
Yeah, I would definitely say that's really important to get involved, get hands-on, you know,
Yes.
you're diving in. If you don't know something, then take time to go learn it, you know, before class, after class, with your classmates, you know, that's
Right.
always great.
Right.
But just get in there, even ask the teachers. There are a lot of times they want to help you make it through this program.
Right.
So.
And I do think that's an important piece. There's a big part of how well you're doing in the program is based on grades, but there are a lot of other things that can determine if someone's doing well or not. And we don't know as instructors until you come and tell us, this is what I'm struggling with. I'm really struggling with, I can recall for the test, but then I don't know how that applies to this scenario.
Right.
So give me some suggestions of what I can do. So definitely go to your instructors and
That's
ask
good.
them, do you have any advice on how to study? And every instructor is going to maybe look at things a little differently too. So don't just go to one instructor, go to multiple instructors within the program, because each person can have a good tip.
Yeah, that's really good feedback right there. That's some good tips to be mindful of. Now, what would you say that you're in the program, but you're about to be done? Like, for those who are getting out into the workforce, what tips would you get on getting a job or getting yourself out there, getting involved in different things? What do you speak to that kind of topic on where would you go once you're done with the program?
Okay. Well, just before you're done with the program, as you know, you have full-time clinicals.
Yes.
So that is where you go to the clinic and you are there for a period of time, still as a student, but you are now putting into practice everything that you just learned from the program. So you're treating patients and you're getting to know the people that work in that site. So I always tell our students that you need to really start developing your rapport with maybe your clinical instructor there, or the supervisor of that particular unit, or the manager of that unit, and use that to your advantage. When you're there as a student, ask the people in that clinic, what do you look for in a new employee? What types of qualities are you looking for when you do think about hiring a new therapist? Another thing you want to think about is, how am I going to separate myself from everybody else? You just got done graduating with maybe 30 to 32 other students, so what is going to make you stand out from somebody else? I think a big thing you can be looking for here now is, how are you going to be as a professional? So how are you going to separate yourself from the norm? Many people are going to graduate with the same grades that you had. You're going to all have the same degree. What makes you different? What makes you the phenomenal therapist that this supervisor or this employer should hire? So what I've always told our students, and I don't know if you remember this at all, in the program, is my goal as the program director is to graduate students that go above and beyond the call of duty. Go in early. Stay late if you need to. Use your lunch hour to treat a patient who couldn't come in during the 8 to 5 time, and they only had a half an hour, and it happens to fall on your lunch hour. Are you going to say, no, sorry, I have lunch that day? Or are you going to put that aside and put your patient first? That's what we want our graduates to do, is we want them to see their patients as more than a diagnosis. They are actually a person. And we want them to be advocates for their patients. We want them fighting for them so that they can get the best outcomes possible from a physical therapy perspective. Because as you know, a lot of times patients don't have a voice, and that's what we can do. So if you're showing your employer that I'm here for the patient, I'm not here just for me, I'm here for the patient, employers are going to notice that. They're going to pick up on that.
Employers would definitely respond well to someone who is motivated and someone who is ambitious enough to go that extra mile that she's talking about. That's a good point. So those were some great tips on if you're looking to start the program, if you already are in the program, and if you are about to be done with it, looking for a job. Those are some great tips from Erin. Right now, we just want to ask her a few different questions. Like, do you enjoy this career yourself? What's it like for you going into work and all that stuff.
I absolutely love it. I part of my role as the director is to talk to incoming freshmen or talk to students in high school who are trying to figure out what they want to do and where they want to take the next step with their education. And actually, I don't know if you knew this, but in 2013, Forbes magazine ranked physical therapy as one of the 10 happiest jobs out there. So I'm not sure if you knew that. And I always tell the high school students coming to see me that I absolutely agree with that. Obviously, our field has its level of stress and it can be very difficult for sure, but never once in my 20 years as a therapist have I ever regretted going into this field or thinking to myself, I wish I would have done something differently. I've loved the aspect of being a physical therapist. The nice thing about this field too is that it's very flexible and it can open many doors. So when I was going to be a physical therapist, I had no idea that one day I would actually be teaching or being an instructor or a director. That wasn't even on my radar. But it's just the way that our field there are multiple things you can do with this particular one degree.
It's very rewarding.
It is. It's very rewarding. It's very flexible. What I've loved about it too is, as a physical therapist, I've been single, and then I got married, and then I started having kids. And one thing that I loved about this degree, or continue to love about this degree, is it has allowed me to do all of those roles and still use my education. So when I didn't have any children, I was working 2 jobs. I was working full-time at Genesis and working part-time here. Then when I started having children and I wanted to be home more as a mother, I could cut back my hours, and I was able to flex my time at the clinic so that I could be working when my husband was home with the kids, so I didn't have to leave the children. So I've loved that aspect.
There's a lot of flexibility in it with your schedule, especially if you do have kids and all that stuff.
You can go and be an early morning. I have some friends that are in the clinic as early as 6 in the morning and are out by 2 in the afternoon. So it's definitely flexible from that perspective.
Yeah. What's it like? So this is something me personally, I want to know what it's like because I only work in the clinic. I only work with patients and people, but tell us what it's like when you're working with students and you got to teach a class, like from a professor aspect. Say one of these people want to be a professor or they want to go into the university setting. Talk to that. Like what's that like, being a teacher, being a director, that sense?
I think a big thing of what you need to be an instructor is, do you have a passion for the field outside of just what a PT does and what they need to do? For me, I know personally, it all goes back to that advocacy for patients and how important it is for any healthcare worker to go above and beyond the call of duty. We've all seen both ends of the spectrum. Those people who just go in on time, they leave on time to collect their paycheck, unfortunately, all the way to those that are coming in early, staying late, and they're putting the patient first. So to me, that is a big reason why I went into the teaching role, was to be able to not only do it myself with my patients, but I was able to then teach my students that there is much of the program, much of the field that you need to know from a technical standpoint, but then how do you apply that to your patients, still make them feel like they are number one. We got to think about the fact that when we're treating patients, they're not going to be feeling well, they're going to be in pain. So I tell my students, you have to be able to explain to a patient why it's important that they come to therapy, even though they don't feel well or they're in so much pain they don't want to move. You have to be able to do all this for your patients so that they do get better, because most of the time they're not going to want to do it. They're not going to want to do the physical therapy. So there's so much that goes into being a good therapist, and I feel like I have the best of both worlds. I can still treat patients and hopefully make a difference in their lives, and then I can bring it back to Baker and try to teach students how to do that. So that when I can't, they're out there doing it.
Exactly. I feel like you even have like a bigger amplitude, like you're able to make a bigger difference because you're not only treating one-on-one individually, but you're preparing the next generation of PTAs to go learn the skills, to go above and beyond. You have much greater impact when you're teaching a group of students who then can go teach the patients and all that stuff.
And I do. I keep that in mind, and I take that very seriously.
So there you guys have it. That's some advice before you start the PTA program, or even if you're in it or you're past it. I just want to thank Erin for taking the time to do this and to be a part of this. I know it's helped me. She's helped me a ton in my career.
Good.
And so I just wanted her to be able to help you guys in your career now.
I want to thank you. I want to thank you for putting our profession out there the way you are. I want to thank you for coming here to Baker College, where you went to school, and giving us an opportunity to show the beautiful campus, and hopefully we get some people interested in coming to see us. And I don't know if you want to say you can show them how to find me.
Yeah. We'll put the link to the college in the description of the video. And if you like the video, hit a thumbs up on it. Leave us a comment if you have any other questions that maybe we didn't cover in this video. And we'd love to hear feedback from you guys. So that's all we got for today.
Perfect.
Peace.
All right.